been able to help several people understand their options and make educated decisions. And so I've been pumped for this video all week. So I hope you're enjoying these videos as much as I am. I hope it's bringing you value and good content. Again, in this crazy world of Medicare, but especially right now, considering it's already October. And so annual enrollment period, or AEP, it's here. So this is, again, a very important time for a lot of people that are already on Medicare, because there are some changes. Again, if you're on a Medicare Advantage plan, there are some changes that you can only make during certain times of the year, and this is it. So October 15th through December 7th. And then the other side of this is the drug plan. So if you do not have a Medicare Advantage plan and you have original Medicare, which is Part A and B, Part D, and then most likely a supplement, those are kind of the four pieces to that puzzle, then AEP is super important for the drug plan side of it. And I said last week, Part D is for drugs, but also for date, because you need to, either you need to look at that every year, or most people have someone, do you have someone? Get someone that can relook at that every single year for you. So I've already been looking at my clients' new plans for 2021. So October 1st on Medicare.gov is when we were able to look and pull up and see the different drug plans for 2021. And so I've already been looking at my clients' drug plans, drug lists, things like that, to make sure that 2021, we get them in the best drug plan for them personally. Because again, Part D is tailored to you personally based on your location, your pharmacy. That makes a big difference in your drug plan. And then also, of course, your prescriptions. And there is a cheaper drug plan this year. Before, the minimum premium for the Part D was $13 and some change. And there's actually a drug plan that is $7 and some change. So that was a positive thing. That would really come into play as well if you are in a drug plan, but you actually don't have prescriptions. You're like, well, Ashley, why would I do that? Well, here's why. So let's say when you turn 65, you are, again, healthy as a horse. You're not on medications. You feel amazing. And so I get a lot of people that say, well, Ashley, why do I need a Part D plan if I'm not on medications? Again, guys, don't shoot the messenger, okay? I'm just here to educate you. I did not make this rule. But the fact is, when you come onto Medicare, when you're first eligible, if you do not get a drug plan, and let's say at 70 years old, so now 5 years later, then you decide to get into a drug plan, you're going to be penalized all the way back when you first turned 65, because you could have had it then and you did not take it. So that penalty is 1% a month that you could have had that. So obviously 1% a month, 12% in a year. So even for the people that are not on a prescription, I still encourage you, man, especially now, you can pay that $7 and some change, get into a drug plan, because again, why do we get insurance? We do not get insurance based on our health now or our situation right now. That's not the point of insurance, right? We are insuring against the unknown future. And so we don't know, will you for sure never have prescriptions, never need a drug plan from now into heaven? We don't know that. So that's a very good news. I'm super excited for the clients that are in that situation. Again, it's almost half the price as it was last year, or this year actually. Anyway, so guys, definitely reach out to someone. Feel free to reach out to me. Again, if you are just turning 65, you're about to turn 65 in the next 7 months, we need to start talking now. I'm licensed in several states. If you are already on Medicare, you're on a Medicare Advantage plan, and you're wanting to understand your options and come off of that, we need to talk now because you have a limited time to make that decision. If you are already on Medicare and you want to reevaluate your drug and your supplement options, again, I help someone on their supplement, a husband and wife save $2,400 in annual premium. So, definitely I would be happy to save you some money. If you don't care about saving money or getting better coverage, then okay. But if you like to save money and get better coverage, then we definitely need to talk. So anyway, hope you guys have a wonderful Medicare Monday, and